Hello, my name is Caio Ciganha de Godoy, and I'm going to present our work entitled In Silico Heart Versatile Graphical Interface with Systole and Diastole phases, customizable for diversified arrhythmias simulations. This presentation is divided in introduction, objective, methods, which is subdivided in heart model, animation procedure, and graphical interface, followed by the results that showcases the working interface, and finally the conclusion. The term in silico heart applies to the computational simulation of the heart. In this context, the animated three-dimensional heart models in virtual environments are handy computational resources for medical simulation or education. 3D visualization can occur in many ways, such as virtual reality, augmented reality, and holography, being the naked eye hologram interface a good option as it does not require head-mounted glasses. As for the application, the 3D visualization and simulations of the heart are useful for preoperative planning, which improve the success of cardiac success, or for medical training in the educational context, as it improves the teaching and learning process in academic settings. Considering all that, an important demand of the heart simulation that is not totally investigated concerns the simulation of the heartbeat, including arrhythmias, customizable to the patients. The objective is to develop a versatile computational interface, which allows the user to control the cardiac beating motion for patient customizable arrhythmia simulations, and to simultaneously interact with the heart model in a convenient 3D visualization interface that includes holographic visualization. The general approach consists of developing a graphical interface which performs the heartbeat simulation, which is essentially an animation process. It consists of using the 3D software Autodesk Maya for rigging the mesh of the 3D heart model, which in turn generated keyframes for morphing. The first step was to find a 3D heart model that was free to use, that contained all the necessary parts: vena cava, the inner part of the atria and ventricles, the external part of the atria and ventricles, aorta artery, pulmonary trunk, and coronary arteries. Then, with the 3D software Autodesk Maya, we created a skeletal structure with rigging bones that starts on a root and branches out to the different regions of the heart, like right and left atria and ventricles. Once the bones were in place, we defined each bone's field of influence on the 3D heart's mesh. Once the structure was ready, the heartbeat motion was manually animated via keyframes, with real heartbeats, timing, and movements based on different ECGs. Now, once the keyframes were set, they were exported to the app in order to perform the animation inside the engine through morphing. The graphical environment, developed in C programming language and using API OpenGL, GLUI, and GLUT libraries, presents the virtual human heart's animation according to the cardiac beating. The heart simulations and interactions obtained with the interface represent the practical results of the present work. The graphical interface has two windows, one to manipulate the image and two to prompt images of the heart model for holographic projection. With all parameters set as variables, it will allow the user to change the time, frequency, and rhythm variables to the individual specific steps of the heartbeat, as well as simulate conditions like arrhythmias and up to 3 different types of atrioventricular blocks. For example, the cardiac rate ranges from 40 BPM, that is beats per minute, to 150 BPM, with the default value being 80 BPM. Additionally, the app has a hologram mode that allows all parameters I've listed so far to be rendered with a pepper pyramid hologram. The holographic projection divides into 4 parts to implement holographic projection in the pepper pyramid. Each part of the window represents a side of the heart model. All the interactions made by the user in the graphic interface affect all 4 models. The illustration of the graphical window used in the holographic projection show the heart's model's rotation to obtain the 4 heart images. Now for the results. This video shows how the app is currently working. It can show exploded views of the mesh, erase parts completely, rotate all X, Y, and Z axes for full control, change the transparency of each mesh component, zoom in and out for better adjustment, regulate a cut on the mesh in 3 different planes: the transverse, the coronal plane, and the sagittal plane. As mentioned before, the app will allow the user to change the time, frequency, and rhythm variables, as well as simulate different conditions like arrhythmias and AV blocks. To wrap up, the hologram mode allows all parameters and features I've listed so far to be rendered with the pepper pyramid. And this is how it looks like currently. As for the limitations, the blood flow and other aspects of the heart function were not the objects of study, neither providing a realistic rendering of the heart model. In conclusion, the graphical interface is a versatile tool as it can be used for diversified cardiac simulations and visualizations. It allows controlling the cardiac beating motion adequately, creating regular rates or arrhythmias, while the user simultaneously interacts with the heart model. It is a kind of tool already proved useful in cutting costs and improving the teaching-learning process in academic settings. It has feasible usages for primary education and training in cardiology. It exhibits versatility and potentiality for future upgrades to explore new medical training and benefit state-of-the-art surgical planning. The present work's main contribution and technical novelty concern devising a heart-beating simulator customizable to the patient cardiac rhythm. We would like to thank FAPESP for the financial support, and thank you for your attention.